Cats have a quiet way of suffering. They don't whimper, they don't cry, they don't hold up their paw like a dog might. Instead, they simply change. They shift their behavior just enough that you might not notice, unless you're paying attention. That's what makes recognizing pain in cats so difficult. But it's also what makes it so important. When a cat is in pain, the signs are subtle. But once you know what to look for, they become much clearer. Pain leaves a trail. It touches everything. How your cat moves, eats, grooms, interacts, and even breathes. Nothing stays quite the same. One of the first things that tends to change when a cat is in pain is the way they move. You might not see an obvious limp, but you'll often notice hesitation. A cat who used to leap up onto the windowsill without thinking now takes an extra second to prepare, or jumps lower than usual. They may avoid certain surfaces altogether. Stairs become an obstacle, not a path. Sofas and counters that were once part of their routine might be skipped. When movement becomes uncomfortable, cats adjust by avoiding it. It's not just about jumping. Pay attention to stretching. Cats naturally stretch multiple times a day. It's part of their muscle maintenance. But a cat in pain may reduce how often they stretch, or stop doing it altogether. They might walk more slowly or rigidly. Some will crouch low to the ground when they move, or appear to walk with shorter strides. These are the kind of changes that don't scream for attention, but they speak volumes when you notice them. Grooming is another behavior that's deeply affected by pain. Cats are obsessive groomers. Their routine includes cleaning nearly every inch of their body, multiple times a day. So when grooming stops, or becomes irregular, it's never a coincidence. If your cat's fur suddenly looks greasy, matted, or dull, it might mean they're physically unable to groom certain areas. Joint pain in the spine, hips, or shoulders can make it uncomfortable to twist and bend. On the flip side, pain doesn't always cause a cat to groom less. Sometimes, it causes them to overgroom. You might see your cat licking the same spot repeatedly, even to the point of thinning fur or creating a raw patch. This repetitive grooming can be a response to discomfort, almost like trying to soothe themselves. It's often seen in cats with joint pain, skin sensitivity, or even internal inflammation, like bladder discomfort or gastrointestinal issues. Pain also changes how cats vocalize. Not every cat becomes more vocal, but many do. A cat in discomfort might start meowing more frequently, especially during movement, when being touched, or while trying to settle into a resting position. The meows may sound different, longer, lower, more strained. Some cats will yowl, especially at night when the house is quiet and there's nothing to distract them from what they're feeling. Even purring can sometimes be a stress response, rather than a sign of contentment. Feeding habits often shift, too. A cat who normally eats with enthusiasm might suddenly leave food behind. They may approach their bowl, sniff it, and walk away. Or they might eat slower than usual, chewing more gingerly. This can happen when dental pain is present, but it's not limited to mouth issues. Even back or neck pain can make the motion of lowering the head uncomfortable. Some cats begin to favor only certain textures, licking up wet food but avoiding dry, or choosing soft bites over anything chewy. Sometimes, pain shows up in the litter box. Not in what's left behind, but in how your cat uses it. If stepping into the box becomes painful, your cat might avoid it. You may find urine or feces near the box or in unexpected places. You might notice your cat straining while trying to go, or seeming restless and unsettled during bathroom time. These aren't always signs of behavioral issues. More often, they're signs of physical discomfort your cat is trying to manage quietly. Aggression is another behavior that can be linked to pain, especially in cats who were previously friendly or calm. If your cat suddenly begins hissing when touched, swatting at people during petting, or reacting defensively when approached, it may not be a personality change, it may be protection. When cats are in pain, they don't want to be handled, especially not in sensitive areas. They might lash out, not out of malice, but out of fear that contact will hurt them more. Other cats go the opposite direction. Instead of acting out, they withdraw. They stop greeting you at the door. They don't come for cuddles. They hide more. They sleep in odd places they've never shown interest in before, under the bed, in closets, behind furniture. They stop initiating play, or they ignore toys altogether. A cat that's no longer participating in their own life is a cat trying to protect themselves from further discomfort. Facial expression can offer additional clues, if you know what to look for. A painful cat may squint more, particularly on one side. Their eyes might seem less bright, less alert. The ears may rest a little flatter, and the whiskers might droop instead of staying forward. Even the position of the mouth and the jaw can change slightly, small shifts that, over time, begin to paint a very clear picture. One more overlooked sign of pain is changes in breathing. A healthy, relaxed cat breathes slowly and rhythmically. But pain can cause shallow, rapid breathing, even when the cat is resting. Their chest may rise and fall more quickly, or their sides might flutter. If your cat starts panting, breathing with their mouth open, or breathing heavily after minimal activity, it's time to pay attention. These are not normal behaviors for a cat and should always be taken seriously. You may also notice tremors or shaking in the legs, especially after your cat has been resting for a while. Some cats experience stiffness that eases after movement, while others become more hesitant to lie down because getting back up is difficult. Older cats in particular may begin to sleep in different positions, choosing flatter or more padded surfaces to avoid pressure on sore joints. Even eye contact, or lack of it, can signal distress. A cat that avoids your gaze, especially during interaction, may be feeling vulnerable. Conversely, a cat that stares at you constantly without engaging in play, exploration, or routine activities might be silently asking for help. They can't say, "I'm in pain," so they rely on expression, posture, and behavior. Pain affects everything. It touches the physical, the emotional, and the behavioral. That's what makes it so hard to pinpoint in cats, and what makes it so essential to look closely. The moment you notice one of these signs, it doesn't mean you need to panic. But it does mean you should start observing more closely. Write down what you're seeing. Track how long the behavior has been going on. Is it getting worse? Is it only happening at certain times of day? Are there other changes happening at the same time? This information can make a huge difference when it comes time to talk to your vet. Don't wait for the pain to become unbearable. Cats rarely show pain until it's already been going on for a while. By the time they're crying out or refusing food altogether, the issue may already be advanced. Early intervention is always the better path. Your veterinarian might recommend diagnostic tests, blood work, X-rays, a physical exam, or even a trial of pain medication to see how your cat responds. For chronic conditions like arthritis, there are treatment plans that include medication, joint supplements, anti-inflammatories, diet adjustments, and even physical therapy. For acute injuries or illness, pain relief can be managed while addressing the root cause. But the most powerful thing you can do, starting today, is observe. Watch how your cat moves. Listen to the way they vocalize. Pay attention to their grooming, their appetite, their personality, their routines. Don't dismiss subtle changes as just getting older or being in a mood. Your cat's body is speaking, just in a language that requires more careful listening. You don't need to be a vet to notice when something's wrong. You just need to be present, patient, and willing to act when something feels off. Because for a creature who can't tell you what hurts, being seen, being understood, being helped, that changes everything.